Welcome back, class. It's Dr. Linder. Let's take a look at the structure of long bone. This is very important to understand the features of long bone. So they have a diaphysis, which is the bone shaft. There are two epiphysi. These are both ends of the bone. There's a proximal and a distal epiphysis. And then just distal to the proximal epiphysis, there is a proximal metaphysis, and then proximal to the distal epiphysis is the distal metaphysis. All right, so basically, it's the region between the diaphysis and the metaphysis, and we'll show you that in the next slide. There's articular cartilage that's covering both epiphysis. There's the periosteum, that's the connective tissue that surrounds the diaphysis. There's the medullary cavity, which is the hollow space within the diaphysis. And then the innermost membrane is the endosteum. That's the thin membrane that lines the medullary cavity. So when we look at long bone, this will make a little bit more sense now. We said that there's a proximal epiphysis, which is this section up here. And then there's a distal epiphysis, which is this section down here. Okay. Then distal to the proximal epiphysis and proximal to the distal epiphysis are the metaphysis. Meta means after. So after the epiphysis is the metaphysis. That's this section right here. And then in between, you have the shaft of the bone, which is the diaphysis. That's the shaft. Now, what we'll have superficially next to the proximal epiphysis and the distal epiphysis, which is this like grayish sky blue, is what we have referred to as articular cartilage, because this is going to articulate with other bones. This will articulate with the scapula at the glenoid cavity. This is the male end, and this is the female end. That would be the glenoid fossa or glenoid cavity. Down in here, we have this section here and this section here are going to articulate with the radius and the ulna. So we have articular cartilage, and it's this articular cartilage that can degenerate and break down. When it does, we refer to it as degenerative joint disease or osteoarthritis. This tends to be a mechanical problem. Sometimes it can happen when you have abnormal forces on normal joints, right? Like if you're holding a jackhammer and is breaking up concrete and you're doing that for 20 years, the forces from the jackhammer that your body is absorbing at the elbows and shoulders and wrists, they can degenerate that over time. And that's not the same as rheumatoid arthritis. Rheumatoid arthritis is a systemic issue. It's an autoimmune issue in which the cartilage is breaking down, but the causes are different. Rheumatoid arthritis tends to be symmetrical, where it affects, both hips, both knees, both wrists, both shoulders. When it's mechanical, it can involve one joint and not the other. So degenerative joint disease and rheumatoid arthritis are not the same causes. And they also look a little bit different. At the proximal and distal epiphysis is where we have something called spongy bone. And spongy bone contains red marrow. This is going to produce our red blood cells. Okay. That'll happen at both the proximal and the distal epiphysis. This is spongy bone, very spongy. It's going to look like this, where you've got lots of trabeculae, lots of pores. And that's different than the diaphysis, which doesn't have spongy bone. It has compact bone. And the magic word with the compact bone is something referred to as the osteon that I'll go over shortly. The endosteum is the innermost membrane, part of that medullary cavity. And the periosteum is the outermost layer. Periosteum is where ligaments and tendons are going to attach. Now, it's compact, but it doesn't mean it's solid all the way through. There is a cavity around compact bone, and that cavity, which is called the medullary cavity, is where we have yellow bone marrow, which is composed of mostly fat. Okay, lots of energy could be stored in there. A lot of your triglycerides could be stored in there. Now, on demand, if we need more red blood cells, yellow marrow can convert itself into red marrow in crisis situations, should we need that. So, spongy bone is found at the proximal epiphysis and the distal epiphysis. And then we have compact bone, which is more in the shaft of the bone, okay, more in the diaphysis. In the center, where that lumen is, that is the medullary cavity. So compact bone is good at providing protection and support, and spongy bone is much more lightweight, and it provides some tissue support. Here's the proximal epiphysis. This is spongy bone, sometimes referred to as cancellous bone. That's where we have our red bone marrow. Just distal to that is the metaphysis. And here's compact bone and the diaphysis. See how solid this is? This from here to here and here to here. That, and of course it goes all the way around, right? It's making a circle. That is compact. And right in the center, that's the medullary cavity that contains yellow bone marrow. The articular cartilage is usually hyaline cartilage. And this hyaline cartilage is usually made up of type 2 collagen fibers. Usually type 1, FYI, type 1 collagen fibers, that's fibrocartilage. Fibrocartilage. Type 1, which is fibrocartilage, is very thick and very strong. And when you think of that, you know, we think discs, intervertebral discs. We think the menisci of the knee. Type 2, these are thinner, not as strong, but thinner, which is why they break down and they're involved with degenerative joint disease or osteoarthritis. Now, the hyaline cartilage can regenerate because what circulates around those joints are synovial fluid. Synovial fluid. And synovial fluid is where the nutrients get absorbed from all the adjacent tissues, muscles, tendons, ligaments, right? We know that cartilage is avascular, so the only place that it can get its nutrition is from the adjacent structures. They can get absorbed by synovial fluid. And when you move your joints, the synovial fluid circulates, nourishing these cartilage cells. When you don't move it, you can lose it. Okay, so motion is very important to help circulate the synovial fluid and to nourish the cartilage cells. But doc, my joints hurt, they're painful, I have degenerative joint disease, I can't move it with exercise. Well, that's where aquatic therapy comes into play, like going in a swimming pool where there's no gravity. It's usually much more comfortable for patients to move around in a pool to circulate all their joints, move around the fluid to nourish the cartilage cells. The articular cartilage or the hyaline cartilage is really designed to reduce friction between the adjacent bones, and it acts as a little bit of a shock absorber. The periosteum, that's that tough sheath. It's dense, irregular connective tissue. It's that outermost layer of the bone, and it's where muscles and tendons are going to attach. The periosteum helps in nourishing the bone because there are many blood vessels that penetrate through the periosteum in order to get into the deeper part of the bone. It's involved in fracture repair and protects the bone. And of course, we said it's the site of attachment for tendons and ligaments. Okay, now here's just another illustration showing and reviewing the proximal and the distal epiphysis. Here's the shaft. This is spongy bone. This is spongy. This is where we have the red bone marrow. That's red. And then here in the medullary cavity, you can see that it's yellow marrow. This section of bone is not spongy, it's compact bone. It's compact because when we look at this, look how solid that looks. These are made up of the osteons. And osteons have these blood vessels traveling right through the center canal, the Haversian canal. So we have nutrient arteries that penetrate through the periosteum, and then they go right through the center of each osteon, which is why when you break bone, bones can bleed. And when they bleed, they form a tumor of blood, and that's called a hematoma. A hematoma is a tumor of blood and a stagnation of it. You can see the yellow bone marrow right here in the center in that medullary cavity. This is the periosteum on the inside here. That is the endosteum. The endosteum. You can see what spongy bone looks like here. Very porous, very spongy. These are all what we call trabeculae. And the trabeculae is involved in bone remodeling, where depending on the type of stresses that are placed in that part of the bone, they adapt to the type of stresses. The more you use it, the stronger they become. The less you use it, then you lose it and they degenerate. That's part of a law called Wolff's Law. Okay, when we come back, we'll get into some of the things that can influence the integrity of bone.